Achlorhydria, Wikipedia article audio. Achlorhydria /EKLRHADRI/ or hypochlorhydria refers to states where the production of hydrochloric acid in gastric secretions of the stomach and other digestive organs is absent or low, respectively. It is associated with various other medical problems. Irrespective of the cause, achlorhydria can result as known complications of bacterial overgrowth and intestinal metaplasia, and symptoms are often consistent with those diseases. Signs and symptoms. Causes. Since acidic pH facilitates the absorption of iron, achlorhydric patients often develop iron deficiency anemia. Acidic environment of stomach helps conversion of pepsin again into pepsin, which is most important to digest the protein into smaller component like complex protein into simple peptides and amino acids inside stomach, which is later absorbed by gastrointestinal tract. Bacterial overgrowth and B1-2 deficiency can cause micronutrient deficiencies that result in various clinical neurological manifestations, including visual changes, paresthesias, ataxia, limb weakness, gait disturbance, memory defects, hallucinations, and personality and mood changes. Risk of particular infections, such as Vibrio vulnificus, is increased. Even without bacterial overgrowth, low stomach acid can lead to nutritional deficiencies through decreased absorption of basic electrolytes and vitamins. Such deficiencies may be involved in the development of a wide range of pathologies, from fairly benign neuromuscular issues to life-threatening diseases. For practical purposes, gastric pH and endoscopy should be done in someone with suspected achlorhydria. Older testing methods using fluid aspiration through a nasogastric tube can be done, but these procedures can cause significant discomfort and are less efficient ways to obtain a diagnosis. A complete 24-hour profile of gastric acid secretion is best obtained during an esophageal pH monitoring study. Diagnosis. Achlorhydria may also be documented by measurements of extremely low levels of pepsin A in blood serum. The diagnosis may be supported by high serum gastrin levels. The Heidelberg test is an alternative way to measure stomach acid and diagnose hypochlorhydria/achlorhydria. Treatment. A check can exclude deficiencies in iron, calcium, prothrombin time, vitamin B12, vitamin D, and thiamine. Complete blood count with indices and peripheral smears can be examined to exclude anemia. Elevation of serum folate is suggestive of small bowel bacterial overgrowth. Bacterial folate can be absorbed into the circulation. Once achlorhydria is confirmed, a hydrogen breath test can check for bacterial overgrowth. Treatment focuses on addressing the underlying cause of symptoms. Prognosis. Treatment of gastritis that leads to pernicious anemia consists of parenteral vitamin B12 injection. Associated immune-mediated conditions should also be treated. However, treatment of these disorders has no known effect in the treatment of achlorhydria. Achlorhydria associated with Helicobacter pylori infection may respond to H. pylori eradication therapy, although resumption of gastric acid secretion may only be partial and it may not always reverse the condition completely. Antimicrobial agents, including metronidazole, amoxicillin/clavulanate potassium, ciprofloxacin, and rifaximin, can be used to treat bacterial overgrowth. Achlorhydria resulting from long-term proton pump inhibitor use may be treated by dose reduction or withdrawal of the PPI. Little is known on the prognosis of Achlorhydria, although there have been reports of an increased risk of gastric cancer. A 2007 review article noted that non-Helicobacter bacterial species can be cultured from achlorhydric stomachs, whereas normal stomach pH only permits the growth of Helicobacter species. Bacterial overgrowth may cause false positive H. pylori test results due to the change in pH from urease activity. Small bowel bacterial overgrowth is a chronic condition. Retreatment may be necessary once every 6 months. Prudent use of antibacterials now calls for an antibacterial stewardship policy to manage antibiotic resistance. Gastroesophageal reflux disease, abdominal discomfort, early satiety, weight loss, diarrhea, constipation, abdominal bloating, anemia, stomach infection, malabsorption of food, carcinoma of stomach.